well for the
introduction. I forgot the name of the paper is The Evolution of Artificial Intelligence in Medical Informatics, Bibliometric Analysis. Thank you, Bruno. Please.
Okay, thank you. So my name is Bruno Penteado. I work at the Oswaldo Cruz Foundation, Fiocruz, in Brazil. And I'm going to discuss some of the results that were in this ongoing project to analyze how artificial intelligence is impacting healthcare. And as we all know, there is an increased adoption of artificial intelligence in every kind of industries. And some authors consider it a driver for a fourth industrial revolution. And since the beginning, the healthcare was one of the most promising applications for artificial intelligence. And some authors, they point out to the personalization of medicine as the main goal for the artificial intelligence. And in respect to diagnosis, therapeutic responses, or even the preventive medicine. And there is a long history of applications, artificial intelligence applications in healthcare. It took a while to start. It was only in the 60s with some expert systems like Dendral and Mycin, and in the 80s, DX-Planning, or in the last decade, the application of big platforms like IBM Watson or Google Flu, and the first application approved by the American FDA, like Arteris. But in this meantime, there were also some periods of what some authors call the AI winter, where there was a low funding in the interest in artificial intelligence because of the high expectations and the low deliveries, the low level of deliveries. And this is something that we should always remember. So our work here was to understand how these technologies and methods have evolved along with the healthcare, not by itself, but how the impacts of AI in the health sector. So our first research question was, how are different periods organized around AI, and how different countries were associated with these technologies? To understand the waves of technological impact on this field. And the second one was how different themes or topics have evolved over these years. Which bodies of knowledge were predominant at a specific point in time. So to that end, we applied a bibliometric analysis. This is a standard methodology here. And we collected the data from the Web of Science using this search string with different terms related to artificial intelligence. Some were taken from the mesh taxonomy, thesaurus. And we imported these results into another tool called Cortex with very different features to analyze the data. Some data visualization, very nice features from the same tool. And the interpretation at the end with some findings, the implications and the limitations on that. So I'm going to skip to results to the good part. So we found over 15,000 papers from 73 to 2021. And this is the increase in the number of papers that were returned with this query string. But there is an issue in the Web of Science papers that no keywords were present until 1990. So we discarded the information before that, because the keywords is the main material for our research questions. However, it's not a significant impact on the results, because only 120 papers were left out. So the main conclusions remain valid. So the first research questions, we applied this period detector It uses a bag of keywords with the top 500 keywords from the corpus, and it computes a cosine similarity between each pair of years. And we found out these 4 different periods from 1990 to these days. The first one from 1990 to 96, and so on and so forth. So to interpret these periods, we have this kind of material. The first one was typically for expert systems in the clinical decision making. The second period was the expansion of the internet and the knowledge representation. And the third one, the longest in this corpus, were related to the ontologies and the rise of machine learning, especially data mining techniques. And the fourth one that we are currently on, the rise of deep learning, in specific big data, mobile health, and social media as data sources. So that there is this contingency matrix relating these keywords, the main keywords and the countries. It computes a categorical correlation, the chi-square correlation for these 2 variables. And we found here some specific terms to be considered. 3 countries were stood out here. The United States, using natural language processing for information extraction from electronic health records. China with deep learning and convolutional neural networks for image analysis and diagnostics. And France with the use of ontologies for clinical decision support systems. This is all significant correlations related to the expected number of papers for each country. And there is also a concentration in the countries. There is an increase in the number of countries participating in this research, the AI in medical informatics, but United States, China, UK, Germany, and France accounts for more than half of this, all the authors involved in all this research. And the second research questions, the main topics which were investigated, we identified 7 clusters. We created this graph of keyword co-occurrences, the edges being the keyword and the nodes being the keyword and the edges being the co-occurrence in one paper, and Louvain algorithm for the community detection for the clusters. So we found out expert systems with these related terms, knowledge representation, natural language processing, computer vision, machine learning. These are the most simple, the most related to sub areas of artificial intelligence. But we found out 2 other clusters here, the use of mobile health and the electronic health for these techniques. And also the security and privacy in data and applications. So it's in line with different authors here, even the textbooks for Russell and Norvig, for example, the traditional subfields from artificial intelligence, but some differences here, the absence of robotics, speech processing and planning, but the presence of mobile health and data security, some important strains of research. And for the themes in the periods, we have this kind of cloud. In the first one here, we have the expert systems, the computer-aided diagnosis, the knowledge acquisition, so on and so forth. The second one, we have the internet and things like fuzzy logic, the neural networks, decision support, image processing. And the third one, we have the semantic web, ontologies, interoperability, knowledge management, data integration, along with privacy and data mining. And in this last one, we have the deep learning and all these techniques, convolutional neural network in particular, mobile health, smartphone, transfer learning, big data, social media, the COVID. And we also sought to explore how they evolved over time, these 7 clusters. So we can see the drop in the interest of expert systems as the main subfield in the artificial intelligence in healthcare in the beginning, but now it's not so very well researched. Machine learning is the predominant subfield, and now deep learning and computer vision is on pair. And knowledge representation also decreased a lot in these last 5 years. But the increase of mobile health and electronic health concepts and techniques, it's also increasing. So for discussion of these results, we found these 4 different periods here. And the first one with the predominance of expert systems, rule-based systems, and the related techniques and applications like the knowledge acquisition, the knowledge engineering, the computer-aided diagnosis. The second with the popularization of the internet in the healthcare. In the third one, we have what I called here the age of interoperability with data integration, ontologies, unified modeling language, data mining. And the last one, new data sources such as social media, mobile health, big data, electronic health records, and the Internet of Things, and the deep learning to explore all this new data. But of course, this research has some limitations. I think the main one is the lack of qualitative analysis, because we didn't dive deeper into the papers. Maybe some representative papers may introduce some new ideas here. The search strategy here was focused on the medical informatics, because the Web of Science provides that code for filtering. And the keywords were only available from 1990 onwards. So before that, we could not infer any kind of relations. So some implications, we try to understand this digital transformation and what is likely to appear in the next cycle. Are we in the 4th cycle yet? Is there a 5th cycle starting now? And 2 of our recent studies here, I would like to share with you. The first one is diagnostic medicine, the main field of application for artificial intelligence now, especially in the image analysis. And we asked for experts considering the next 10 years, and they considered 2 main barriers for the adoption. First one, the incorporation of AI to clinical practice. I think this is the main issue, but also the regulation of artificial intelligence in healthcare. There's a lot of issues to be resolved here in liability or data privacy or things like that. But many countries now are developing their national plans for artificial intelligence. So this is a topic to be watched in the next few years. And the other one, a recent paper from our group, we published in the MSIS conference in information systems. We identified 4 different waves of technological waves in the medical informatics. And this new one is called the digital health wave by different authors and institutions. And it has some new supporting technologies, such as new sensors, the smartphones, the wearables, the Internet of Things, the social media. Some colleagues here presented some works using this kind of data from the sensors, but also some new AI techniques from natural language processing and image processing in particular. But we need to understand that AI in healthcare is part of a bigger picture. There is very critical socio-technical aspects to be considered here: the patient and the doctor relation, their trust, their privacy, and it's included in the health system, and it must obey some public policies. So we need to consider that when developing new tools. And again, we have very, very high expectations with artificial intelligence in healthcare, but much caution is necessary to avoid the new artificial intelligence winter, such as the 2 previous ones. So our conclusions here is the convergence of the bibliometric analysis and the subfields of artificial intelligence. Most of them were very well represented in our corpus. These 4 technological cycles, homogeneous cycles in the use of keywords, the importance of this infrastructure on the cycles and how it impacts the development of artificial intelligence, and this shift from knowledge engineering, the rule-based and so on, to learning from data, especially the image diagnosis and the diagnosis from electronic health records. So thank you for your time, for the audience, and please, any questions?
Thank you very much, Bruno. I think we have only enough time for one question. If you have, if someone wants to, I don't see any request to make a question, but I have some comments just to finalize your presentation, because it is very pleasant to see your presentation, because I just lived all those phases from the second AI winter when I started working in artificial intelligence. So I lived all the phase, and I feel this is very, very accurate.
Oh, that's good.
Yes, and I think in the future, the future challenge will be also the trust and the credibility of the AI implementations, just to succeed and avoid the third AI winter. I don't know if you agree with me, but it's one of the most important aspects now.
Yeah, we have some regulation problems that I'm studying.
Also, yes.
But that the full automation of the tasks, it's prohibited in every country. So most people think that AI will replace doctors and things like that, but this is not the way. This is not where we're going to now. It's a support system, but I consider it as a second opinion for physicians and for doctors, you know.
In a decision support approach, and not in a expert system approach.
Yeah.
That's why the expert systems lose all the initial energy, because they intend to substitute the experts in the work. So people are not able to lose the jobs for to be substituted by an automatic process. Okay. Yeah. Well, we need to finish. I would like to thank you very much to all the presenters and all the attendants. I think the people that will participate in the EPIA meeting is waiting to use this link. So good afternoon. Thank you very much again. See you next time. Next division.
Bye-bye.
Bye-bye.
Bye-bye. Thank you very much.